The Vermont legislature has reconvened under a new governor and with new House and Senate leadership. I've been at the State House with Jessa Barnard and Stephanie Winters giving overviews of the work of the VMS, and have been very well received. We have a great team at the State House and are working closely with the various legislative committees. I'll be testifying later this week on a bill related to medical marijuana. While the bill the VMS generally supports, we will strongly oppose the requirement that all physicians have to take 1 hour of CME every 2 years on the issues related to medical marijuana. I also just met with the Deputy Commissioner of the Medicaid program, and the VMS will continue to work to increase Medicaid reimbursement, particularly to primary care physicians.
The Senate Judiciary Committee has begun taking up a Bill S3, which addresses a mental health professional's duty to warn. This relates to when a mental health professional has a duty to take reasonable steps if a patient of his or hers communicates potential threats of violence to another person. And the bill is in response to a Supreme Court decision that was issued this past spring and then again in the fall, and has created a lot of confusion for the entire mental health community, hospitals, psychiatrists, community providers, community agencies. So the Vermont Medical Society is working with a broad stakeholder group, including mental health facilities, other community providers, to support this bill in the Senate. The Senate has taken 2 days of testimony so far, and we are working on getting the committee some clarifying language and answering some of their questions, and the committee plans to take it up again next week. The second bill we've been working on is a bill to expand the Vermont Practitioner Health Program. That is a program run currently by the Medical Society under contract with the Vermont Board of Medical Practice that provides supports and evaluation and other services for Board of Medical Practice licensees who have concerns with substance use disorder, and we are looking to expand that program to also be able to serve licensees with mental health conditions, and that will require a statute change. The Senate Health and Welfare Committee has discussed the bill and seems very supportive, and we will later this morning be talking to the committee further and hope that that moves along smoothly.
There's a bill in both the House and the Senate on Tobacco 21, which would be to increase the age of the sale of tobacco products to 21 from 18. We are following that bill and part of a coalition to strongly support that bill, so we will keep you updated on that as the bill moves through. There's also a bill that Representative George Till, our physician member in the State House, has introduced on adverse childhood experiences. He will have 2 bills, but one right now is on resiliency and really strengthening services and programs that support families in their times of need. So we'll be watching that bill and the companion bill that goes along with that as well. Any bills that we are following, healthcare related, can be found on our website, vtmd.org, under our advocacy page.